Recognizing the 10 warning signs of stroke in women. Welcome to today's video, where we embark on a vital journey to uncover the 10 most important warning signs of stroke in women. Did you know that every 40 seconds, someone in the United States suffers a stroke? What's even more alarming is that women are at an even greater risk. Imagine this. Recognizing a subtle change in your body could be the very thing that stands between life and death. This video aims to educate you about these critical warning signs specific to women and equip you with preventative measures and treatment strategies. Understanding these signs could not only save your life, but also the lives of those you love. Before we dive in, please help amplify this life-saving message by hitting the like button. If you're new to our channel, subscribe and click the bell icon so you never miss content focused on combating heart disease. Stay with us until the end, where we'll reveal how you can claim 2 complimentary gifts dedicated to heart health. Let's get started. Number 10. Sudden numbness or weakness of the face. Time is brain. A saying every neurologist will echo. Stroke, the 5th leading cause of death in women, according to the CDC, often begins with sudden numbness or weakness in the face, arm, or leg, usually on one side of the body. This isn't a sign of mere fatigue or aging. It's a silent alarm of disrupted blood flow in the brain, impacting muscle control and sensation. Women, due to hormonal fluctuations, can experience vascular conditions that exacerbate these symptoms. A simple smile test can help. Ask the person to smile and check if it's symmetrical. Also, have them lift both arms. If one arm drifts downward, it's a red flag. Immediate emergency care is critical to reduce permanent damage. Prevention and action. Regular cardiovascular checkups to monitor blood flow and detect early issues. Adopt a diet rich in omega-3 fatty acids, fruits, and vegetables to maintain healthy blood vessels. Recognize these symptoms early and call emergency services immediately. Number 9. Mental confusion and trouble speaking. Sudden mental confusion or difficulty speaking is a critical but often overlooked stroke sign. This occurs due to impaired blood flow to brain areas responsible for language and comprehension, such as Broca's and Wernicke's areas. Women often experience subtler symptoms, perhaps struggling to follow conversations or feeling as though words are slipping away. This isn't just forgetfulness, it's a disruption in thought and speech pathways. Prevention and action. Practice cognitive exercises like puzzles and reading to keep the brain active. Monitor for high blood pressure, which is a leading cause of strokes. Encourage prompt medical evaluation if any confusion or speech issues arise. To assess, ask the person to repeat a simple sentence like "the sky is blue." Difficulty speaking or understanding could signal a stroke. Recognizing this sign early can mean the difference between life and long-term complications. Number 8. Vision problems. Vision disturbances, such as blurred or double vision or complete vision loss, are common early indicators of a stroke. These symptoms arise when blood flow to the occipital lobe or visual pathways is interrupted, leading to visual impairments. For example, a sudden curtain, like loss of vision or doubling of everything in sight, are telltale signs. Prevention and action. Would schedule regular eye exams to catch underlying issues that might signal vascular problems. Manage chronic conditions like diabetes, which can contribute to vision-related stroke symptoms. If vision changes occur suddenly, seek immediate medical care to rule out stroke. To identify vision issues, Cover one eye and observe any changes. Sudden vision loss, difficulty focusing, or seeing spots require immediate medical attention. Ignoring these signs can delay life. Saving treatment. Number 7. Dizziness or loss of balance. Sudden dizziness or loss of balance can severely disrupt everyday tasks. These symptoms often point to a stroke affecting the cerebellum or brainstem, regions responsible for coordination and spatial orientation. You might feel the room spinning, vertigo, or struggle to stand or sit upright without support. Prevention and action. We engage in balance, improving exercises like yoga or Tai Chi. Avoid smoking and excessive alcohol consumption as they increase the risk of stroke. Pay attention to any sudden coordination issues and seek immediate help if they occur. Try standing on one foot or walking in a straight line. If this proves unusually difficult, it could be a stroke sign. Immediate intervention not only addresses the stroke, but also prevents injuries from falls. Number 6. Severe headache with no known cause. A sudden, intense headache with no apparent cause may indicate a cerebral hemorrhage, a stroke caused by bleeding in the brain. Described as a thunderclap headache, this pain reaches peak intensity in seconds and can be accompanied by nausea or loss of consciousness. Unlike migraines, these headaches are abrupt and excruciating. Prevention and action. Monitor and manage blood pressure levels consistently. Avoid overusing medications like SAIDs, which may increase the risk of cerebral hemorrhage. Recognize unusual headache patterns and seek emergency care immediately. If you or someone else experiences such a headache, seek medical attention immediately. Quick action can mitigate damage and save lives. Number 5. Sudden trouble with walking. Unexpected difficulty walking is another warning sign. Stroke. Related disruptions in motor coordination can lead to an unsteady gait, tripping, or feeling the need for support. This isn't clumsiness. It's a potential stroke affecting brain areas controlling movement and balance. Prevention and action. Maintain regular physical activity to improve strength and coordination. Control cholesterol levels to prevent blockages in blood vessels supplying the brain. If someone stumbles or falls unexpectedly, prioritize immediate medical attention. If someone stumbles or falls without cause, immediate medical evaluation is essential to prevent further complications. Number 4. Unexplained fatigue. Profound, sudden fatigue without a clear cause can signify a stroke. This isn't ordinary tiredness, but an overwhelming exhaustion stemming from disrupted energy regulation in the brain. If fatigue is so severe that it impairs daily functionality, for instance, making it impossible to get out of bed, it's time to seek help. Prevention and action. Prioritize adequate sleep and stress management to maintain overall health. To regularly check for warning signs like anemia or thyroid imbalances, which could exacerbate fatigue. Combine this symptom with other stroke indicators for accurate assessment. While this symptom alone might not always signal a stroke when combined with others, it demands urgent attention. Number 3. Face drooping or an asymmetrical smile. One-sided facial drooping or an asymmetrical smile is a hallmark stroke sign. When the brain's motor cortex is affected, facial muscles weaken, causing these symptoms. Conduct a smile test. Ask the person to smile. If one side of their mouth doesn't rise equally, it's a strong indication of a stroke. Prevention and action. Adopt healthy habits to prevent stroke-related damage. Be vigilant about sudden changes in facial symmetry and seek help immediately. Use the BEFAT method for rapid diagnosis and intervention. Prompt action here is crucial. Quick diagnosis and treatment can drastically improve outcomes and minimize long-term effects. Number 2. Sudden nausea or vomiting without a clear reason. Nausea or vomiting without an obvious cause could point to a stroke, especially when accompanied by other symptoms. These signs arise when parts of the brain controlling digestion are affected. While they may not immediately suggest stroke, their sudden onset should not be ignored. Prevention and action. Stay hydrated and monitor any gastrointestinal issues that could mask stroke symptoms. Avoid high sodium diets that increase stroke risk. Seek prompt medical attention if unexplained nausea occurs alongside other signs. Seek medical evaluation if unexplained nausea or vomiting occurs alongside other warning signs. Number 1. Brief loss of consciousness. A sudden loss of consciousness, or syncope, is a critical stroke warning. When blood flow to areas of the brain controlling wakefulness is disrupted, fainting can occur. This is distinct from lightheadedness. It's a complete, albeit brief, loss of responsiveness. Prevention and action. Monitor blood sugar and blood pressure regularly, as imbalances may lead to fainting episodes. Avoid skipping meals, which can cause sudden drops in blood sugar levels. If loss of consciousness occurs, call emergency services immediately to rule out stroke. Immediate medical attention is non-negotiable for this symptom. Failing to act quickly can lead to devastating outcomes. Preventing strokes begins with awareness and proactive health management. Regular checkups to monitor blood pressure, cholesterol, and cardiovascular health are vital. Lifestyle changes, like a balanced diet and regular exercise, so play a significant role. Knowing the warning signs and acting swiftly using the BEFASAT method, balance eyes, face, arms, speech, time, can save lives. Have you or someone you know encountered these symptoms? Share your stories to educate others. If this video has highlighted the importance of recognizing stroke symptoms, show your support by liking, subscribing, and sharing. Don't forget to claim your 2 free gifts: our exclusive ebook and groundbreaking video on cardiovascular health. Thank you for watching, and remember, awareness and timely action can be life-saving. Stay safe and informed.